On the Scene video coverage of AHA 2012 is supported by Pradaxa.
Welcome to On the Scene here at AHA 2012, where the dal-OUTCOMES trial has just been presented, a study of Dalcetrapib, an agent that is a CETP inhibitor aimed at raising HDL, but a very disappointing result with really no benefit seen in preventing cardiovascular events. Do you want to comment a little bit on the trial and what you thought of it?
Yeah, so it was a compound that people are very excited about. You know, the idea of CETP inhibition leading to really substantial rises in HDL. We've been having a little bit of disappointing experiences over the past year with AIM high not showing a positive outcome. But there was a lot of enthusiasm that with a CETP inhibitor that might lead to a more substantial rise in HDL levels, Dalcetrapib in the range of 30 to 40% rise in HDL, that might translate into improved outcomes. But what we learned today, that did not appear to be the case. And I think we got a lot of important insights into possible mechanisms as well.
Yeah. This was in a post-ACS setting, so the highest risk, although sometimes difficult to modify early events. Two things the investigators pointed out: a slight increase in hsCRP and, interestingly, a very slightly higher blood pressure. With torcetrapib, that had been felt to be only attributable to an off-target finding related to aldosterone in the adrenal glands, but it has popped back, and so I think some new questions on the mechanism. There are other trials ongoing, but we'll simply have to see if this pans out. I suppose the other aspect that's come up is, what does this mean about HDL function? And that's another component.
Right, you know, we know that there are substantial rises in HDL with these inhibitors, and yet the question is, are these functional HDLs? Are they just large, perhaps dysfunctional HDL particles that are being increased in size, or are they really going to be able to translate into improved outcomes?
And that does seem to be now an area to re-look at how does the function of HDL work. Is it different? And initial studies have suggested in a post-ACS setting or in diabetes or both that the HDLs are more dysfunctional than in other patients. And so more questions is always raised by big new trials that are being addressed in other trials. So for CVN and On the Scene, I'm Chris Cannon.